Dry socket, how do you manage it? Dry socket happens when the socket is not filled with the blood clot. So after extraction, the site is empty and that site needs to be filled with the blood. But once that is compromised by some negative pressures as you are drinking with the straw, or while you're sleeping, or while during the daytime, you might do right to clean up the socket, or you might use some toothpick to remove, or as you are brushing your teeth, you might remove those blood clot. So if the blood clot is removed, the bone is exposed, right? If the blood clot is removed, bone and nerves are exposed to the environment, and now you begin to feel pain. And also without blood clot, it heals slower. So the blood clot is just like a bandage after the extraction. Dry socket may not happen right after the extraction, or it may happen like days after, 2 days, 3 days, 4 days after the extraction. And the pain may vary. Some patients cannot sleep and it is super painful. Some, it may be just irritating. And even though the name is dry socket, you may not see dry socket. If you take a look clinically, you may see some pus, inflamed tissues, or blood clots with some darkened spots. And you may see some bones are exposed. It is not really super dry socket, no. So this is the step that you will be doing when you are treating dry socket. First, numb the patient. Sometimes you don't need to anesthetize the patient. Depending on the tolerance of the patient and severity of the dry socket. But I recommend, it is just my recommendation, to numb the patient really well so that you can clean the socket, and scraping the bone or scraping the tissue out might be uncomfortable. So I first tried infiltration, but infiltration was not sufficient and I ended up giving the block. So for the lower, I recommend to give right away block and make it all right at once. Second step is using the surgical curette. Remove the old clot. You don't need to curette so hard that you might damage the bone so much, but just slightly gently curette it, scrape it, then it'll bleed and the blood will fill the socket. But sometimes, depending on the severity, irrigation may be enough. To introduce the medication into the socket, get a gel form and soak it with the dry socket medication. Just place it into the socket. It'll just dissolve away, so most of the times you don't need a suture, but if the tissues are really floppy, then place the suture. And the rationale of placement of the gel form is just to deliver the medication, not to fill the voids. When I saw the gel form soaked with the medication, the smell is really strong because it is eugenol. I was thinking, oh, if the medication is not delicious, it will be torturing to the patient. So after the procedure, I got the medication. Oh, but it is not bitter, but it is like too strong that it numbs your tongue a little bit. And it has a very, very strong eugenol clove, the clove. It has the strong flavor of clove. And it was, if you like the clove, probably it'll be okay. Like when you are eating biryani, you eat cloves, right? But for me, food with the cloves are not common food to me. So the taste was very strong. And I was thinking, oh, how could the patient bear this taste? But it is better than having pain. Even though we treated the dry socket with medication, the pain may come back. Only thing that they can do is just to wait. Some patients, they suffer the pain for 2 to 3 weeks, and then once the wound heals, then it is okay. The time is the best treatment. To control the pain, take ibuprofen. 3 hours after, take acetaminophen. 3 hours after, take ibuprofen. 3 hours after, take acetaminophen. Alternatively, take the medication. Hope you learned something, and all the best with your dentistry journey. Bye bye.